I've been with the Red Cross, it's going on 25 years. And in that time, all of my work has been within Indigenous community. I'm Cree First Nations from Northern Alberta, but I've lived on Lekwungen territory for going on 30 years, and so sometime here. I came here to go to school and have stayed here ever since. And really, the urban Indigenous community here has very much become family for me.
I can say that in the 30 years that I've worked from coast to coast to coast in Arctic communities and northern communities, this year is really something. And you know, we're going to talk a little bit about the services we've been offering, but I can honestly say that the virtual environment, even though we always use email and we always use screens, it is something else, and we're constantly aware of how this response is shifting and having an impact on us as people, on our families, and on our colleagues and our work. And that's some of the stuff that we think about and try and bring into our connections with communities as well.
Our work is about creating safe environments. That's what we want to contribute to. And right now, creating safe environments actually means staying apart. I don't know that I ever thought that I'd be one to say that, you know, and I know that those words feel really like a disconnect within our communities, but that's our truth right now, is that our wellness depends on staying apart. You know, so one of the things that we've really had to do is start to get a lot more creative around how do we come together in a place of having to be apart. And so in the Canadian Red Cross, this is the thinking, and this is really the brainstorming that we deeply went into around how do we keep our support present, how do we keep education happening, how do we keep certifying people, you know, to be trainers, to be educators, you know, to be community support people in this presence of not coming together. And hence came along the virtual operations team.
All of these people and this team virtually are there for you, a phone call, an email away, and at any given time. So we are available to you 24/7 in the event that you had an emergency that you just needed some guidance on. Maybe you have an idea on how to respond to an issue in your community, and you need to kind of bounce the idea off of one of us and say, does this work? Have you experienced this in your community? Can you give us any guidance? Can you give us any recommendations? Or what do you think is the best solution to this issue? We face many of them in our community, and we have found some great solutions that work for us. Maybe they'll work for you. So how can we help?
We're very fortunate to have a public health unit really that works in international settings, in complex and challenging environments where there are epidemics, outbreaks, and various situations that can be life-threatening for communities. That team is used to setting up mobile hospitals, clinics, navigating the health scenarios on a regular basis. And so the first thing we did was really look at that team coming in to support our Indigenous work.
So to date, over 260 Indigenous leaders have requested assistance from us across Turtle Island. And that could either be through reviewing of their administrative policies, that can be updating their pandemic policies, that can be doing a virtual learning session on one of the social platforms, and we can teach on how to properly don and doff personal protection equipment. That means gloves, mask, so on and so forth. So it can be a virtual learning, it can be reviewing policies, it can be teaching what roles and responsibilities are, it can be helping you to develop your pandemic plan. There's many ways that we can assist. One particular community, which I was super proud of, actually put in place, they did the training, they developed their plan, and they even tested their plan. That was the best step. You know, let's see how this would actually work out. What if we did get somebody that was COVID-19 positive and we had to put them in an isolation area. How would it work out? How can we support that person that tests positive, their family, and how would our staff react? So that was really good. And these are all ways that we can help you.
You know, as we just resonate in the strength of who we are, there can also be an increased resilience and an increased practice in our birthright, which really, for me, I do want to celebrate that.
The best part of my job is hearing the community say, "You lifted a weight off my shoulder," and knowing that you're here for me. I'm not alone. I might be alone physically, but I'm definitely not alone in terms of the support. I have you, and I have the staff, and all I had to do was make this phone call. It's words like that that really get to me, and that, you know, it knows, like, I know that we're doing a good thing and we are helping, and these resources and the people that are available to them just like this, and you know, and talking to them live and providing them with this feedback live as they're asking it, it's making a difference. Even clinical staff that have said that, I really appreciate knowing that you're there. Thank you. And that's what makes this worth it.